If you are watching this video, you may have had a missed miscarriage recently. We're so very sorry for your loss. A missed miscarriage happens when your baby dies, but you don't have any signs or symptoms of miscarriage. Most people find out at an ultrasound scan, which can be a real shock. After a missed miscarriage, doctors will need to make sure the remains of your baby and pregnancy tissue are no longer in your womb. This is sometimes called management of miscarriage. As your baby died when you were less than 14 weeks pregnant, there are 3 ways this can happen. These are called expectant management, medical management, and surgical management. The risks of infection or other harm are very small with all 3 options, and your chances of having a healthy pregnancy next time are the same with each method. We'll go through all these options with you now to help you decide what's best for you. Expectant management means waiting for the miscarriage to happen by itself without treatment. It could be a good option for you if you don't want medical or surgical options and don't mind some waiting and uncertainty about when things will happen. During expectant management, you will bleed from your vagina. You may pass large clots and tissue. It's possible you may see something you recognise as a pregnancy sac or your baby. This can be distressing, especially if you're not expecting it. You will also have pain and cramping. Many people say it feels like very strong period cramps or like early labour pain. When you start bleeding, it will be heaviest for the first few days. Then it should get less and stop within 2 to 3 weeks. Sometimes it can get heavier again before it gets lighter. Expectant management is successful in around half of people who have it. If bleeding doesn't start within 14 days, isn't stopping or is getting heavier, your doctor will talk to you about other options. Medical management is where you take medicine to help the remains of your baby and pregnancy tissue come away from your womb. You may prefer this if you don't want to wait for the miscarriage to happen by itself and you don't want surgery. NICE guidelines recommend that you are given 2 drugs. You will take mifepristone first and another medication called misoprostol 48 hours later. This is more effective than just taking 1 drug. After taking misoprostol, usually as a pessary inserted into your vagina, it can take a few hours for bleeding to start. Bleeding will be heaviest for the first few days. Then things will usually happen in the same way as they would in expectant management and take a similar amount of time. Medical management is successful in 85 out of 100 people who have it. Surgical management means removing your baby and the remains of your pregnancy using a gentle suction device. You may opt for surgery straight away if you do not want to wait, or it may be offered to you if other options are not successful. The surgery may be carried out under general or local anaesthetic, and it will happen in hospital. Surgery is successful in 95 out of 100 people who have it and is very safe. You will be able to go home as soon as you feel well enough to do so, usually the same day. You will probably have some bleeding from your vagina, which may last up to 2 weeks. You may also have some cramps in the first couple of days after the operation, but these will be more like period cramps than contractions. These decisions can be difficult, especially so soon after finding out your baby has died. Your doctor or nurse should explain if any options are not suitable for you and why. They should give you the time you need and answer any questions you have. You may want to ask them more about the risks and recovery times for each option. You can read more information and find help to decide which option is best for you on our website.